Halajay Beliveau from Claws for Applause Nail Academy. Thank you so much for joining me for another video. Today we're going to cover client consultation and waiver forms. Now, I'm going to split this up into a three-part series because it's going to be fairly long. Let's start with our client consultation form. If you've never heard of it, if you're not familiar, we will cover that, so don't worry. So let's begin. Now, your form can look any way you want it to look. This is just how mine looks. I use this with my students in my nail academy, and like I said, yours can look any way you'd like it to look. It's up to you to design it, to put on it what you please. This is just going to give you a rough idea. So for the client consultation form, it's super important that you know your client on a personal level, okay? So when you go see the doctor, the first thing they do usually is hand you a clipboard because they want your personal information. We also want our client's personal information. We're not doctors, obviously, but we want to be on the same level of professionalism as a doctor. So without further ado, your client consultation form should include things like your client's name, their phone number, email address, their date of birth, preferred name, do they have a nickname, how did they hear about your services, and do they have any allergies. Then you want to go over their nail service history and their preferences. So just answer the following questions regarding your nail history and preferences. It's going to go over things like your current nail condition. Healthy, brittle, peeling, ridges, weak, other. Obviously, you as a nail technician are probably going to have a better idea once you do an assessment of your client's hands and nails. So, have they had any previous nail enhancements? If yes, what types? Acrylic, gel, hard gel, dip powder, builder gel, nail tips? Are they currently wearing any nail products? If yes, what types? What type of service are you interested in today? Are they there for manicure, pedicure, gel polish, acrylics, etc.? Do they want any specific design, or do they have any color preferences? Do they have any nail biting or picking habits? If yes, please describe. Have they had any reactions to nail products in the past? Yes or no? Are they currently taking any medications that may affect their skin and nails? This is a big one. They don't really talk about this in nail school or in the nail industry in general, but medications can play a big role in your client's nail health and how their nail enhancements last. So for example, I know some chemotherapy treatments will actually cause premature lifting of the nail enhancements, just because the chemotherapy can tend to weaken, obviously, and thin out the nail plate, which in turn makes those natural nails brittle. So basically, when we're trying to put a nail enhancement on the natural nail, the more solid it is, the better, because if you're trying to anchor to something that's kind of flimsy, it's not going to end well, okay? You're going to have a lot of lifting going on, so just be wary of that. Keep that in mind, okay? And then, is your client pregnant, or are they trying to become pregnant? Do they have any medical conditions that you should be aware of? Are they diabetic? Any kind of skin conditions, circulatory issues, weakened immune system? Do they have any cuts, sores, or infections on their feet or their hands? Obviously, like I said, when you're doing your overall assessment of your client's hands and nails, this will give you a better idea as to what you're dealing with, okay? And is it their first salon visit for nail services at your salon? Probably will be, because when your client comes, they're not going to fill out a client consultation every single time unless their information changes, okay? And if their information changes, they don't have to refill out the whole form. Say their phone number changes, you can just make a note and update their phone number. So really, you're going to just really go over the client consultation form initially when you're first seeing that client in your salon for the very first time. So if it's a new client and that's their first time in your salon, you're going to do a client consultation form. The next thing, do they have a desired nail shape? Okay, square, squoval, round, oval, almond, stiletto, coffin, ballerina, or other. What's their desired nail length? Do they want their nail short, medium, extra long, extra long? And then as well, it's always good to sign off on your client consultation form along with your clients, just to acknowledge that they understand that it's their responsibility to disclose all relevant health information and any potential allergies or sensitivities, and that they acknowledge that the nail technician will use this information to provide the safest and most suitable service. I agree to release the nail technician and salon from any liability for adverse reactions if I have failed to disclose any relevant information, okay? You're going to sign off on it, and your client is going to sign off on it as well. And it just says, thank you for completing this form. We look forward to providing you with a wonderful nail experience, okay? Boom, done. That is your client consultation form, okay? Moving along, we have our nail technician service waiver. So this is going to protect you to a certain degree, okay? This is not a get out of jail free card, but this can protect you legally to a certain degree. So again, this client waiver form, or you can call it the nail technician service waiver, whatever you'd like to call that, a client acknowledgement and a consent form. So just getting your client's consent to perform any kind of nail services on them, as well as explain any risks and make sure that they acknowledge that, okay? So again, same thing, full name, date of birth, phone number, email address, date of service, services to be performed, manicure, pedicure, gel polish application. It's going to go over things like, I understand and acknowledge the following. Allergies and sensitivities. I've disclosed any known allergies, sensitivities, or adverse reactions to nail products, chemicals, latex, or metals. I understand that if I have failed to disclose any such conditions, the technician is not liable for actions. That your client understands that the technician follows strict sanitation and sterilization procedures. However, there's always a minimal risk of infection associated with any skin service, and that your client accepts the risk. Nail health. Just saying that your client acknowledges that improper nail care, biting, trauma can lead to nail damage, and that we are not responsible as nail technicians for the long-term health or appearance of natural nails beyond the scope of the practice that we provided. So, client biting their nails, if they're causing trauma to that natural nail, that's not on you. When it would be on you as a nail technician is, say, you went a little bit crazy with your e-file, and you overfiled that natural nail plate and you caused some damage. That is the difference, okay? All right. And then also, that the results may vary, and also, this is a big one, minors, okay? So, if you have somebody that's a minor come in, they need to have their parents' consent, and you need to get that in writing. So, not only do I have a form like this, if I have a minor come in, I have a separate form for the minor and the parent to sign, as well as this form, and as well as the client consultation form. Make sure the parent signs off on all three, okay? And I also want to make another note. It's very important not to be applying acrylic or hard gel, builder gel on children's nails, okay? Because their nails are still developing, their nails are very fragile. If you damage their nail, the natural nail or the matrix area, it will cause their nail to grow improper or not grow at all forever. So be very careful. Gel polish is okay. Make sure you have the parents' consent though. That is super important. And then I also want to shout this from the rooftops, if I could, but important considerations for your clients' aftercare. I even have this posted on the wall in my salon, and I also go over it with my clients every single time. So every single time I finish a service on them, I always go over their aftercare instructions with them. Okay, so to ensure the best results and for your nail enhancements to last the full duration, please follow these aftercare recommendations. So avoid prolonged exposure to water, especially in the first 24 to 48 hours after gel polish or enhancements. That means acrylic too. So you can definitely wash your hands, obviously, but don't be going swimming right after you get a nail enhancement done, or soaking, in the tub longer than need be, if that makes sense, okay? Acrylic is really bad for this, especially in the first 24 to 48 hours. Use gloves, so if your client is performing household chores, washing lots of dishes, like I said, that prolonged exposure to moisture or chemicals, anything like that, they do lots of gardening, advise them to use gloves. Make sure you're advising your clients as well to moisturize. It's super important that they apply cuticle oil and hand lotion regularly so that they can keep their skin and nails hydrated. Do not pick or peel. This one is huge. Avoid picking at gel polish, nail polish, or nail enhancements, as this can damage your natural nails. File carefully. If a nail snags or lifts, gently file it smooth or contact the salon for a repair. So I always recommend contacting the salon. I've had clients who try to file it at home, and they'll come back and the nail that they try to file, it looks a little wonky, no longer universal across all 10 fingers because they have the one finger nail that's looking funky from them trying to file it themselves. I've also seen clients file a little bit too far into their sidewalls and cause some damage as well. So just be mindful of that. And you wouldn't think of this, but it's super important that you apply sunscreen to your hands to protect against UV damage, especially if you have nail enhancements. The waiver myth. I want you guys to know that a signature does not make an unsafe service safe. So just because your client signs off on it, if it's not safe, then it's not legal. Okay? Alright, so that is our client consultation form and our nail technician service waiver, or our client waiver form. Okay? So now we're going to jump in a little bit deeper here. A professional nail technician doesn't simply perform the service the client asks for. A professional assesses the client, identifies risks, chooses an appropriate service, knows when to modify the service, knows when to refuse the service, and documents what happened. Okay? I really want to emphasize strongly that an acrylate allergy isn't just a theoretical concern. Uncured acrylate monomers can actually act as irritants and allergens, and nail technicians are among the occupational groups at risk. So if you get some on your skin, or if you get some on your client's skin, quickly wipe it off. Use a lint-free wipe with some isopropanol alcohol, or you can also use acetone. Make sure you're removing it though from your client's skin. Make sure when you're working with gel, it is being fully cured in your lamp. Now, I want to go over some things that nail school doesn't teach you. Well, most nail schools. My nail school does teach you this. Applause for Applause Nail Academy, ladies and gentlemen, check it out. Okay, so some consultation, contraindications, client safety, and professional decision making. By the end of this part 1 series, like I said, there's going to be 3 different parts, so watch out for part 2 and part 3. So in this part 1, you should know by the end of this lesson why a consultation is more than paperwork. Okay, you should be able to identify information that should be collected before performing a service, recognize potential contraindications and red flags, explain the difference between irritation and allergy at a basic level, and explain why repeated exposure to uncured nail products matters. Okay? So first of all, you're not just doing nails. A beginner often thinks, my client booked acrylics, so I'm doing acrylics. A professional thinks, my client requested acrylics. Now I need to determine whether acrylics are an appropriate service for this client today. Those are 2 completely different methods. Your client's requested service is the starting point, not the automatic conclusion, okay? A client may arrive wanting long coffin acrylics, full cover tip set, build-a-gel, gel polish, a refill. But maybe after your client consultation and doing the assessment of your client's skin and nails, you come to find that your client's natural nails are severely compromised. And so what I mean by severely compromised is they have extensive lifting, their skin is broken, they have had previous reactions to nail products, their occupation makes their requested length impractical, they have been picking their enhancements off, they have unexplained nail changes, they have significant tenderness, and their expectations are not realistic. Your job is not to make the sale at all costs, okay? Your job is to make a professional decision. The consultation is your first professional service. Many of my students think, I'll just have them sign the form. No, that's not it. The form is only part of the consultation, okay? A proper consultation involves, I'm going to write this down just so you guys can visualize it a little bit easier. Okay? So AOADDD, ask, observe, assess, discuss, decide, and document. That is how we're going to do it. That is what a proper consultation involves. So ask. Ask the client questions about previous nail services, previous reactions, allergies, sensitivities, skin conditions, nail concerns, medications or treatments, when relevant, occupation, hobbies, water, chemical exposure, previous lifting, previous breakage, desired result, and maintenance expectations. Observe. Look at the client's natural nail plates, surrounding skin, cuticle area, sidewalls, free edge, existing product, lifting, breakage, redness, swelling, any open areas, and anything unusual. You're not diagnosing, remember we're not doctors. You're observing and recognizing when something requires caution. Assess. Ask yourself, is the service requested appropriate for today? Discuss. Explain. What you recommend, why you recommended it, what the client can realistically expect, how much maintenance will be required, what the service is going to cost, and what the risks or limitations are. Decide. Proceed, modify, decline, or refer. Document, record relevant information. That is a professional consultation. The questions that actually matter, I teach my students that not every question needs to feel like a medical questionnaire. The consultation should be relevant to the service, okay? So previous nail services, ask, what type of enhancements have they worn before? How long have they been getting their nails done? What product are they currently wearing? When was their last service? How was the previous set removed? Have they ever experienced lifting? Have they ever experienced pain, burning, itching, or swelling? And have they ever had a reaction after getting their nails done? And then ask the important follow-up. What happened? Don't simply record allergy. That's pretty broad, okay? We need to be more specific than that. This is a really good place for me to teach you guys and also my students at my academy something that they often don't understand, or something people quite often don't understand, okay? So not every reaction is automatically an allergy, okay? A client may experience irritation from excessive filing, acetone, cleansers, cuticle products, repeated water exposure, chemical exposure, friction. Allergy contact dermatitis is different. It involves an immune response to an allergen, okay? Acrylics used in nail products are a recognized cause of allergic contact dermatitis, and symptoms often include itching, redness, swelling, blistering, and reactions can sometimes appear away from the immediate nail area as well. Alright, a previous reaction deserves investigation. It should never be casually dismissed. Never deliberately put uncured products on a client's skin to see if they are allergic. Never, ever, 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 ever. This is not an allergy test, okay? Remember, we're not doctors. Exposing your client to acrylates, like I said, can cause allergies. We want to be super mindful of that. The big acrylate lesson, okay? So this is going to be one of my strongest teaching moments here. So your goal isn't just simply to create beautiful nails. I mean, obviously that is part of it. But our goal is to control unnecessary exposure. Uncured product should not routinely be allowed to sit on surrounding skin or the nail plate. Why? Because repeated exposure to acrylate monomers can contribute to sensitization and allergic contact dermatitis. Nail professionals themselves can be occupationally exposed through repeated handling of these products. I want you guys to understand that preventing skin contact is better than relying on product cleanup after, okay? So your best bet is just to prevent getting it on your skin, period, rather than getting it on your skin and then cleaning it off your skin, okay? So your best bet is to avoid getting it on the skin in general. This means controlled application, correct product quantity, appropriate brush control, keeping product off surrounding skin, we've already discussed that, proper curing according to the manufacturer's instructions. Make sure you're always checking depending on the brand you're using. Some say a full cure 60 seconds, other brands will be 90 seconds. Like I said, it depends on the brand that you're using. Make sure you're checking with the manufacturer or the manufacturer instructions. Cleaning accidental contact promptly and appropriately, okay? So you're not going to be cleaning it off, you're not going to be cleaning gel off your client's skin with like Windex, okay? No. Like I said, acetone or isopropyl alcohol. And following product-specific safety instructions, okay? So not necessarily only the manufacturer's instructions, but as well as the safety instructions that go with that specific product or brand that you are using. Okay, and use appropriate PPE and ventilation. Make sure you always have a good ventilation system. You're getting good airflow in and out, and you can wear gloves too. A lot of nail technicians do wear gloves. That's fine, or they can wear masks. If you don't have a ventilation fan to take away the dust when you're e-filing off bulk from acrylic or gel. So you can wear a mask, but at the end of the day, an extractor fan is always your best bet. That's going to take all of that dust and microplastic, essentially, that you're inhaling out of the air. Because I don't think a lot of people know this, but when you're filing your nails, the dust from your nails can actually hang in the air for about 40 minutes. Alright, so that's it for this part 1. I hope you enjoyed. I'm sorry it was super long. We covered a lot in this part. Keep an eye out for part 2.